We certainly enjoy seeing women for their annual exams and feel that's a really important part of their overall health care. But I think that our office, and I know that our office, provides so much more for women. We see women from their teenage years all the way through menopause.
At the group, we are really proud that we have one of the highest VBAC, which stands for vaginal birth after cesarean section rates in the region. We are very happy to offer vaginal birth after cesarean section. The decision on whether or not to proceed with a vaginal delivery after a prior C-section is really a conversation that we have throughout the pregnancy with the patient and with the providers. We talk about risk factors in the pregnancy, the indication for the C-section, and the risks of both a repeat C-section versus attempting a vaginal delivery.
Genesis East has a very good NICU such that our gestational age limit is 30 weeks gestation and beyond, where the physicians at the NICU at Genesis East are in collaboration with the University of Iowa, which is one of the premier NICUs in the region, if not the country.
I am so thankful to be there. I know my patients are going to be well taken care of. It's really a pleasure to work with such great people. So I think one of the greatest benefits to this practice is the number of providers that we have. We work so closely with each other, collaborating. We are able to work as a team to provide the best care for each individual person.
We have some of our practitioners here who've been practicing honestly longer than I've been driving a car. And so I can ask them questions about, hey, have you ever seen this before? I also think it begs that we can look at a person's chart multiple times and making sure that I tell people 7 sets of eyes is better than 1 set.
There are certain situations that we look at on an individual basis that maybe a patient would be better served at the University of Iowa, but I would say that's more rare than common. And usually if there are high-risk pregnancies, we're able to monitor the pregnancy or care for the pregnancy together in a collaborative way, which I think is great.
We would be so disappointed if we did not see a woman again after her delivery, because we do develop these relationships together during her pregnancy. And we are obstetricians, but we're also gynecologists, and that's a huge part of our jobs that we really love.